Hi, my name is Josh Morgan, and today I'll be talking about global health challenges. I'm a senior nursing student at Bloomsbury University, and I chose this topic as it closely relates to my field of study. Today I'll be talking about infectious disease and non-communicable diseases. So, looking at a background, I'll be speaking about non-communicable diseases. Um, these diseases are present worldwide. Examples are heart disease, diabetes, chronic respiratory diseases, mental illness, and Alzheimer's. Non-communicable diseases are the leading cause of morbidity and mortality worldwide, and while these are present worldwide, they are more deadly in poor countries due to the lack of resources that they have. Now, I'll be talking about infectious diseases. Infectious diseases have a higher mortality rate in poor countries, just as non-communicable diseases. This is due to some different factors, and these include a lack of resources, presence of ethnic conflict, global warming, and trade. Different types that I will be talking about are HIV and AIDS, Ebola, malaria, influenza, and severe acute respiratory syndrome, or SARS, as I will be abbreviating it that way. The first infectious disease that I'll be talking about today is HIV and AIDS. HIV and AIDS is transmitted through blood and bodily fluids, and this causes a decrease in immunity in the patients. Some statistics. In 2017, the World Health Organization stated that 36.9 million people around the world were living with HIV and AIDS. Of those 36.9 million people, only 56% were receiving treatment. A contributing factor to the high rate is intravenous drug use, sex tourism, mother-to-child transmission, and through blood transfusions. HIV diagnosis, treatment, and prevention has improved in recent years. The development of antiretroviral therapy, or ART, has greatly improved outcomes of people suffering with HIV and AIDS. Accessibility in poorer countries makes treatment difficult and increases the rate of transmission. Now moving on to Ebola. As some of you may know, the Ebola outbreak started in 2014 in Guinea. This outbreak spread to Liberia and Sierra Leone. Ebola has been responsible for more than 11,000 deaths worldwide. In looking at efforts to counteract this disease, the World Health Organization allocated $100 million to improve surveillance of the virus, protect healthcare workers, and help individuals understand how to avoid being infected. The World Bank and the African Development Bank distributed $260 million to Guinea, Liberia, and Sierra Leone to strengthen their healthcare systems. Johnson & Johnson and GlaxoSmithKline agreed to cooperate to develop an Ebola vaccine and to produce millions of doses quickly. The European Union donated $250 million to develop new Ebola vaccines, drugs, and diagnostic tests. This greatly improved the treatment of Ebola worldwide to decrease spread and worsening. Now speaking about malaria. Malaria is the most common vector-borne illness. It is transmitted through the bite of female mosquitoes infected with this disease. It is most common in areas where there is a swamp or where there is stagnant water. Typically, this is where poor populations live. In addition to having a lower socioeconomic status, they lack resources to fight the disease and prevention. An estimated 1.5 million people die annually from malaria. 90% of deaths caused from malaria occur in Africa. The Bill and Melinda Gates Foundation has been crucial in donating $35 million to supply bed nets to countries in Africa. Other international organizations and countries donated $82 million to fight malaria. From these two, death rates have decreased by 60%, which is very substantial. The development of vaccine RTS-S by GlaxoSmithKline reduced the rate of disease by 1/3 in children. As we are approaching that time of year again, influenza or the flu is most common. The flu is contagious and transmitted through droplets such as mucus. This disease causes symptoms such as aches, fever, vomiting, nausea, and other. This disease is highly preventable through use of the vaccine. Although in recent years people have opposed the vaccine, every opposition has been proven false. Approximately 5 to 10% of the American population get the flu, and 36,000 will die. Worldwide, about 1.5 million people die per year from the flu or complications associated with it. Governments, non-government organizations, and international organizations put forth efforts to quarantine those affected and vaccinate everyone that is able to receive the vaccine. Severe acute respiratory syndrome, or SARS, is a life-threatening respiratory illness that originated in China in early 2002. This severe respiratory illness was responsible for many deaths worldwide. As it originated in China, the disease spread to Vietnam, Canada, Ireland, the United States, and Singapore. Global communications allowed for the spread of information regarding SARS prevention and treatment. In the efforts to find the cause of SARS, 60 teams were recruited from the US, Britain, Germany, France, and other countries. The recruitment of these teams led to the development of prevention and treatment of SARS.